Linda Hirsch, and this is EdCast, a program created and produced by educators for everyone interested in education. After a year marked by fear, isolation, and grief, we might be breathing that sigh of relief as vaccines take effect and COVID-19 cases decline. The return to normalcy we've all been waiting for might actually be upon us. Part of that return is the reopening of schools in September and the mayor's decision that all learning will be in person. This is welcome news for parents and teachers, and even some students. But the return to in-person instruction is a skill we may have lost. Schools and families will face many challenges as they re-enter classrooms. Many children have grown used to being at home, while others have experienced severe loss and trauma. The severity of the readjustment will be contingent upon the many factors of students' lives before and during the pandemic. What are some of the stressors students will face? How can families and schools help students make this transition back to the classroom? Today, EdCast welcomes back Dr. James Rodriguez to join us for this conversation. Coming up now on EdCast. Joining me today is Dr. James Rodriguez. He is Director of Trauma-Informed Services at the NYU McSilver Institute. Dr. Rodriguez is a psychologist and New York State licensed social worker with over 25 years of experience providing mental health services to children, youth, and families. Thank you so much for joining us today on EdCast, and welcome back.
Thank you for having me.
On your expertise, so I'm glad you'll be sharing it with us today. There is a sigh of relief that students are going to be returning to school in the fall. And, there won't be online instruction anymore. But we're already seeing indications that this might not be such an easy transition for families, for students. And I'd like to discuss with you this morning some of the challenges that parents, children, and schools might be facing as we return to the classroom. And what can we do maybe to make this an easier transition for everybody? So I guess the first thing I want to know is in terms of most children, how do you think most children will do in returning to school?
Yeah. Well, again, thank you for having me, Linda. And I think this is an incredible topic to talk about now. I think that most students, most children and youth are going to do well. Young children especially are resilient. They are able to be flexible and adapt well to change. Just as many of them did adapt well to the change of, lockdowns and having to learn from home. Many of them will also adjust well to going back to school. So, and I say that because I think it's an important point, because I think sometimes I do on the one hand see a kind of looming and kind of scary mental health challenge as kids do come back to school. So I think there will be spikes in many things, and we could talk about that later, I think. Yeah. But I think the main point is that most children will adjust well in coming back to school.
So let's talk about some of the common stressors and the mental health challenges. I know for some children, and maybe for many, a common stressor is going to be just separating from home. They've gotten used to being home, maybe parents and caregivers have been around them. So they may, what do you think families might expect from children who might just not want to go back to school, and what could be done for that?
Yeah, so I think that preparation is critical. It occurs to me that some young children, especially like preschool children, for some of them, the going back to school, maybe entering school for the first time as kindergartners and first graders. But there's a few things that parents can do. One is very simply to track their children and talk to their children about their feelings about going back to school. So being able to have those conversations, and I would say very specifically, just asking children very broad questions. Don't lead them, but ask them, how are you feeling about going back to school? And of course, as you suggested, in some cases, parents may already be getting the message from their kids that they're not excited about going back to school. But what's critically important is validating those emotions and letting them know that those are understandable emotions. Not spending too much time there, but that certainly validating those emotions and letting them know they're understandable. I think the other thing that parents can do is just set the tone. So they have to stay calm in having these discussions with their children, stay calm, not raise the fears. They can model calm and sort of approaching this, sort of in a relaxed manner. And then I think parents can also do some work around, getting kids to think positive. Certainly there are things about going back to school, separating from their parents. It's going to be difficult, but also trying to think about the positive things about going back to school. When kids are operating out of fear and anxiety and stress, and I think as we've talked about in the past, Linda, when you're operating out of that, it's hard to think about the positive. So what are those things that you are looking forward to going back to school, whether it's friends, teachers that you liked, just activities and other things. So really trying to focus on those positive aspects of going back to school, and promoting that positive thinking. And in some cases, it could also include practice separating, especially for young children. So you have time over the summer to take kids on, play dates and other opportunities to separate. So I think those are some of the things that parents can do. And of course, I should also say setting up routines and getting kids to sort of feel comfortable about getting up early as they get closer to the start of school. And then, and then of course, some of the other things, emphasizing safety, because I think for some kids, there could be that separation anxiety, but also the anxiety of going back to school and the safety issues at school.
You've already alluded to mental health spikes, and what do we already know about mental health issues as a result of the pandemic?
Well, again, I've been looking for it and I haven't seen hard data on children's mental health. However, I think I mentioned previously, I know we had a discussion about a year ago on this as well, that we're already seeing spikes among adults in things like depression and anxiety, suicidality, and PTSD-like symptoms. And so in many cases, I always like to say, if we see it in adults, we're going to see it in children. And then also very recently, I know that the Colorado Children's Hospital declared a public mental health crisis because of many kids coming in for serious mental health difficulties. Again, depression and anxiety, eating disorders, other kinds of disorders that require immediate medical attention. And so we're seeing that there's some data coming in and some anecdotal data coming in around children's increasing mental health challenges.
What are some of the traumas that kids might have experienced during the pandemic that would cause this?
Well, just the adjustment of, again, the social isolation, the withdrawal, being disconnected from friends. And some of this is kind of the normal, I would say, adversities that kids were facing as part of this pandemic. Again, staying at home, socially isolating, not being able to go out, not being able to stay in contact with friends. But then on another level, of course, any family stressors. And that includes everything from circumstances like having parents who had to work through this pandemic, and in some cases being alone at home. In some cases experiencing other family stressors like abuse and violence in the home, or just family conflict in the home, having difficulty with parents with mental health issues. So in many cases, there are many stressors that kids could have faced. And I'm just naming a short list of them, but there are many things that they could have experienced in the home that could be, traumatic stressors. Oh, and of course, I forgot to mention the fact that the loss of a loved one, having experienced serious COVID-19 symptoms and or death. So the list is long.
Are schools prepared for this at all? Are things in place that you know of that will help children when they come back in the fall?
What I'm hoping to see is that schools begin to develop a plan, in many ways, a disaster mental health plan, a crisis mental health plan for returning back to school. And I do know that there's some, that New York City, for example, in some neighborhoods, it's targeted, but they are preparing to do mental health screenings of kids returning back to school. As I said, it's not universal, and it's not going to be across all New York City schools, but I do understand in some of the more heavily impacted areas, they're going to be doing mental health screenings of kids. I think that's a good first step. And I believe I mentioned to you, Linda, we did a series last year in preparation for the return of schools that really laid out a plan for schools in preparing for the return of children. And that plan included, and we sort of take a public mental health approach. So we think about, sort of 3 levels of prevention. It's sort of universal strategies that are things that you can do to make sure that all kids feel safe and comfortable coming back to school, but also some interventions for kids who are experiencing, more severe difficulties and problems adjusting back to school. Those kids who may have, again, experienced loss or are experiencing more difficult anxiety coming back to school. And then really collaborating with mental health providers at that. So that's the second tier. The third tier would be intervention and treatment for those kids who are experiencing more serious mental health problems and collaborating with mental health providers. In short, that's a basic model for what schools can be doing to prepare for kids in a comprehensive way to make sure that all kids, the needs of all kids are addressed as they return back to school.
I've been that's very helpful. And that's something I guess parents and families should be looking at, I guess, in terms of the schools. We were talking, I've been seeing information about social anxiety, those children who already before the pandemic had some issues of social anxiety. What happens in a family when a child, really doesn't want to go back at all, or really has tremendous anxiety just about, the being back in that environment?
Yeah, so I would take it a little bit broader than social anxiety. So certainly that is going to play a role. And, it's funny because I know there's a lot of talk right now for everyone in society, right? There's talk about people going back to the workplace and experiencing social anxiety and the awkwardness and difficulty of coming back. So it's going to apply for kids. But I would broaden it out. So social anxiety, separation anxiety, as we already talked about, but also a number of other disorders. For some kids, social anxiety, kids with ADHD or learning disabilities, kids with other kinds of mental health, depression, and other kinds of disorders. What I could foresee may have happened for many of them is that they may have become accustomed to, right, being away from school that can oftentimes be a place that can be highly anxiety producing. Again, whether you have social anxiety or ADHD or any other a number of other disorders, going back to school can be incredibly stressful for them. And so what can be really difficult for those kids is that it can lead to school avoidance, attendance problems, especially for older kids, because older kids, there's some of the strategies that I talked about earlier can work well with younger kids, but as you get to older kids and teens, those kids may begin to sort of have serious problems with attendance. And again, it could be driven by social anxiety, but also a number of other disorders. I think in those cases, when I talk about those higher level interventions that are going to be critically important is, there's some things that parents can do. Number one is intervene early. If your child has a history of, again, social anxiety or any of the other disorders that we talked about that can interfere and really make going back to school threatening and difficult for them, then intervene early, seek help. There are some things that parents can do as well to try to deal with those kinds of school avoidance is the term that we typically use for that, school avoidance issues, which is, to really reinforce the importance of school, make sure that school is, not an option. Going to school is not an option, but in some cases, and also not reinforcing the anxiety and fear of going back to school, not reinforcing the avoidance. One of the most difficult things for anxiety disorders is, right, avoidance. And so when you feed that avoidance, when you allow kids to stay at home and not engage, it just reinforces, because for kids with anxiety, that avoidance really reinforces the anxiety, right? Because when they avoid, the stress levels drop, and that in itself is reinforcing. So it can really cycle very quickly. So intervening early. And then again, in some cases, for those kids who do have more severe disorders, this is where collaborating and working with mental health professionals, getting treatment, collaborating with schools as well, and trying to figure out what are the issues, what are the main issues that are keeping kids from going back to school? What are their fears? What are their difficulties? What are their challenges? Were they bullied? Are they afraid of the high demands of going back to school? There's no shortage of stressors that schools can represent. So, but identifying those for the kids, and then trying to work collaboratively between parents, mental health providers, and schools to come up with plans to address those challenges that those kids are facing with, again, with more severe mental health issues.
We've also been hearing about learning loss. Now, I know there's no hard data on that either. Some data says there's a lot of learning loss and says not so much learning loss, but for some there probably has been some falling behind. What do you think will be some anxieties caused by that, both maybe academically and even emotionally?
Yeah, so I think that's going to be a critical issue. One of the things that I do worry about, that if schools, and I think you mentioned earlier, right, what schools can do to prepare. One of the concerns I have is that because of that learning loss, schools may feel the pressure to address that academically, right? So going back and hitting the academics hard to try to get kids to catch up. And of course, there's other complicated issues, Linda, that I know you always are concerned about in your work, which is, the achievement gap, racial achievement gap. So again, some of those demands and some of those concerns can be very valid when you see achievement gaps. But I strongly believe that schools need to be thinking about, again, addressing the mental health needs, the social emotional needs of kids first. If they begin to prioritize and put high pressure and high demands on kids to catch up, that could be a recipe for disaster, especially for the kids that we're talking about. Those kids with, either sort of low level, moderate level of anxiety and or other disorders, or more severe mental health disorders. So that can be an incredible challenge. And going back to what we've talked about in terms of developing a comprehensive approach to make sure that all kids' needs are met. Is critical. So it is this balance. And I certainly do think, though, that the learning loss is an issue, because, of course, that can affect kids' self-esteem, especially for older kids, in terms of their learning loss and their preparation in some cases for kids who are preparing to go to college, and, sort of thinking about higher ed. Those challenges can be very powerful in terms of, driving that need to achieve academically. So I think it's a critical balance to make sure that we are trying to sort of help with that learning loss, but as well, again, addressing the social emotional needs of students.
I hadn't really thought about that learning loss and the pressure on kids emotionally also to catch up. That's a very good point. You alluded already to the issues of safety and how people might feel about returning to school. We know that even some parents wanted to hold on to the online learning because they weren't so sure that schools are safe in terms of COVID for their children. What do you think schools could do to help alleviate some of that anxiety just about, COVID safety?
That's a great question. So again, I think as much as possible, as we've often said, as everyone has said throughout this, is that following the science is a critically important part. So making sure that the guidelines are being followed. And so we know right now that sort of mask mandates are lightening up a little bit. But still, those are the critically important pieces. So really, schools can really lay out what their safety plan is, what the expectations are for mask wearing and social distancing, being able to also inform parents around vaccination rates and ensuring that there's good information about vaccinations and getting vaccinations and all the other things that are going on to help kids feel safe. So information is really the most important piece. As much as possible, giving kids information that will help them feel safe and reassure them that everyone's doing as much as possible to keep them safe is going to be critical for all this. And as I said, schools can do it by sharing their safety plans with parents, and parents, of course, doing the same and sharing those with their children. I
should add that teachers are concerned as well. I don't want to leave teachers out of this mix, because I know that they also have anxieties about COVID safety, especially because, younger children are not likely to be vaccinated. Certainly the very younger ones are not going to be. And of course, teachers have their own concerns, and I hope the schools will address some of those concerns as well, because I know younger children do not transmit COVID that readily and are certainly said to get it from us more than they're giving it. But I know that teachers are concerned, so I hope there'll be some attention paid to that as well. So we're running a little bit low on time, so I want to make sure that you have a chance. I know your McSilver Institute has a number of webinars that are available, but if you could control the return back to school and you could put in place the most important factors that will ease this transition, what can you tell parents and kids and teachers, and what would you like to say? I know you've already outlined a number of things, but as a sort of bottom line, what do you think should be in place all around to help make this an easier return?
That's a great question. I think the safety issue that we talk about right now is I think a big one, is making sure that as much as possible, kids have the information and parents have the information around what's going to help them stay safe in that return. And that information can be, critically important. I think the other, some of the other pieces is, again, talking to your kids. I think in terms of some of the things that I raised earlier, communicating with children, having those conversations with children around, going back to school and what their anxieties can be, would be a critically important piece. But I would say the bottom line is, again, and this I have already said, I'm going to sound repetitive, this is being mindful that I think for all kids, it's going to be a stressful return. I think that even though, as I said earlier, most kids are going to do fine adjusting, adapting, and getting back to school. But I don't think I would say any child is necessarily going to feel no stress. So there's going to be some level of stress. And I think just identifying that and understanding that for many kids, the stress levels are going to be higher than normal, and sort of creating the space to make sure that those kids, the children's stress levels are reduced in whatever way. And that includes, as I said, the safety issues, but also teaching kids ways of relaxing. I mean, I think some of the things that I hope I see schools doing is teaching them regulation skills, having, mindful moments, and doing some exercises that allow the kids as they come back to school to find some relaxation and stress reduction activities as part of their daily routines, so that all kids have the opportunities to experience and have the opportunity to sort of reduce their stress levels, both for children as well as teachers and everyone in a school building. So I think those kinds of things can really be helpful in terms of lowering the stress level in general. And I say that also because what can happen is, again, if you're doing things to increase the stress levels, as we mentioned earlier, really overly focusing on academics and putting high pressure on kids, in many ways, it's going to make it more difficult to identify and differentiate between the kids who have sort of garden variety difficulties and stress and anxiety from those kids who really need the extra help that they require to get through this because of more severe mental health difficulties. So that's why I say I think you can gum up the works if you, again, focus overly on academics and not enough on the social emotional needs of kids.
That's a good reminder. We only have a minute or two left. I wanted to give you an opportunity to tell us a little bit about the resources that might be available at the McSilver Institute.
That's great. Absolutely. So as I mentioned, last year we did this. So we in preparation for school reopening last year, we put out a series of webinars at the McSilver Institute through the Community Technical Assistance Center of New York. So if you go to the McSilver website, you'll be able to find a list of resources and webinars that we put together. Some of the webinars included, sort of, as I mentioned earlier, this sort of broad framework for preparing and developing a good sort of crisis mental health response for kids that looks at kids across the spectrum and at various tiers of prevention. So we did that. We also had some offerings around some interventions that you can use in schools for kids who have experienced trauma. So group interventions. I think group interventions for those kids who've experienced grief and loss, or who've been through traumatic events during COVID-19 and experienced higher stressors. For those kids, there may be opportunities, and there are certainly some good evidence-based group interventions for kids who've experienced higher levels of stress, anxiety, and trauma. And then we've done some work around grief and loss and some interventions to address the grief and loss of children. And then some of the additional work that we have in there that we would also like to include is understanding depression, because again, that's another thing that we're seeing spikes in with children. So how to address kids with depression. And so there'll be information in there available at the McSilver Institute around COVID-19 and understanding depression, and in particular, depression among children in communities of color.
That's terrific. We're completely out of time. Those resources will be posted on the show. And I want to thank you so much for this conversation, Dr. Jim Rodriguez of the McSilver Institute. This was so helpful. I wish you a safe summer and enjoy some post-pandemic activities. And to all of the parents and teachers out there, don't stay at home. I don't want to go back to work, because that will set a bad example, right?
Yes, yes. And same to you on everything, Linda. And thank you for having me.
Thank you so much. Don't go away. We'll be right back with our Ed Bites. Welcome back to this edition of Ed Bites. This summer, the city is offering a free summer school program, Summer Rising, for any student grades K through 12 who'd like to participate. The innovative program combines school and recreation and is available for students making up for some learning loss or just looking for some fun. Summer Rising will provide academic supports, social emotional learning, and enrichment programming such as field trips and art activities. There are specially designed programs for students at all grade levels, including those with IEPs. In addition, high school students can engage in the Summer Youth Employment Program and the Public Schools Athletic League. Summer Rising locations will be available in every borough, and safety protocols will be in place. For more information and to register, go to the newyorkcity.gov website. That's it for this edition of EdCast. We wish you all a happy and a healthy summer. We hope that some of our pandemic-themed programs over the year have provided useful insights and perspectives on education during COVID-19. Thanks for watching, and see you in September.
I'll be alone each and every night. While you're away, don't forget to write.
I'd like to hear from you. Please send your thoughts and comments to CUNYEdcast@gmail.com.